Hi, my name is John Consalvi and I'm the CEO of Lingua Health and Grupo Lingua. I'm here today talking to Brenda Gorman about issues in speech-language pathology. Dr. Gorman currently has an advisory role as the Director of Clinical Services for Lingua Health and Grupo Lingua. We're happy to have Dr. Gorman here with us today.
Thanks so much for having me, John.
Brenda, let's think a little bit about the demographic changes in our country and the importance for bilingual speech-language pathologists related to this. We all know that there are very few bilingual speech-language pathologists and that the demand is quite high. Can you talk a little bit about why somebody should choose a bilingual speech-language pathology profession?
Absolutely. I think a lot of people may be watching this, may be interested in speech-language pathology because they've seen the consistent ratings, that speech-language pathology is an excellent, very promising field, good salary, good work. We like what we do. And the trend is going to continue. With bilingual populations, that is probably even more true. We know that English language learners, children who are learning English as their second language, are of the fastest growing segments of our population. And we also know that even in our aging population that is also increasing with the baby boomers. So speech-language pathology is a fabulous, wonderful, rewarding field, and bilingual speech-language pathology to me is just icing on the cake. You get to work with wonderful people, and again, the demand is very high. Even in areas that are traditionally not to be thought of as having high bilingual populations do. Even the 2000 census data. We don't have our recent data out quite yet, but areas like Georgia, Arkansas, North Carolina, Minnesota, all of these states are having some of the fastest increases in English language learners.
And where are bilingual speech-language pathologists most needed right now?
Well, given what we know, I'd say many parts of the country. There are many languages when I'm talking about English language learners. Almost 80% of English language learners do speak Spanish as their first language. And of Spanish speakers, we know states like New Mexico, California, Texas, Arizona, Colorado, Utah, Florida, New York, Illinois, and then again these states that are having some of the fastest increases that I mentioned. So we're really across the country seeing lots of need in a lot of different areas.
And when you were in undergrad, why did you decide to choose to become a speech-language pathologist, a bilingual speech-language pathologist?
I think I was of a handful of us who didn't know about the profession before we got into it. So I started out in engineering and Spanish. I went on to Latin American studies. I was trying to find the right thing that incorporated the science and the language and working with people. And it was pure coincidence. I had actually graduated in Latin American sciences. I think maybe a month after I graduated, I saw a flyer that said bilingual speech-language pathology. And I thought, wow, that sounds very interesting. What is that? So it wasn't until after I graduated, but I did shadow, which I highly recommend to students who are interested and want to learn more about the field. If they can find someone to shadow, that's excellent. I found, in fact, a bilingual speech-language pathologist and shadowed, went to some preschool centers with the SLP and loved it and enrolled, and that was pretty much the start.
Brenda, thank you very much for coming out to talk to me about bilingual speech-language pathology issues. Hopefully, we'll see many more bilingual speech-language pathologists entering our profession soon.
As do I. Thanks much.